Turning now to tonight's Health Spotlight, the rapid spread of RSV is one of the top health stories in the country right now.
Wish TV's medical team is staying up to date on the evolving situation. Let's start with our medical reporter, Dr. Mary Gillis.
Indiana hospitals are battling a surge in RSV infections, with doctors calling the numbers staggering. I want to show you this graph from the CDC that shows the jump in Indiana RSV cases that occurred in just the past 5 weeks. Joining me now to talk about the most asked questions is Wish TV medical expert and former Surgeon General, Dr. Jerome Adams. Dr. Adams, welcome.
Well, great to be with you as always, but unfortunate to be here under the circumstances, as you mentioned, considering that we're seeing a significant increase in pediatric hospitalizations.
Very true. I wish it were under different circumstances. Well, Dr. Adams, just how bad is this right now?
Well, right now, it's very regional, and it's important for people to understand that's the way a lot of these respiratory viruses evolve. It may hit New York hard, and then it may hit Chicago hard, and then it may hit Indiana hard. We first saw increasing cases in the Northeast, in New York, in Boston. But as you mentioned, we're now seeing increased pediatric cases in Indiana as the weather's getting colder, as more people are getting indoors. It makes the environment more hospitable for a respiratory virus like RSV. And we also know that many people haven't been exposed to this the last several years because of COVID. They've been inside, they've been wearing masks. And so now they're exposed, and we're seeing that on top of what is shaping up to be a difficult flu season. And hospitalizations are unfortunately rising rapidly.
Dr. Adams, how can parents protect their kids?
Well, that's a great question. One of the things that we can do is remember the 3 C's: clean, cover, and contain. We want to clean surfaces. We want to make sure we're washing our hands for 30 seconds at least with soap and water. I often tell people to sing the ABCs or tell their kids to sing the ABCs when they're washing their hands. That's how we protect ourselves against most respiratory viruses that transmit by droplets. But something else you can do is get your kids vaccinated against flu, and to talk to your provider about whether or not a COVID vaccination is appropriate for your kids. In most cases, it will be. Why does that matter? Well, because many of these viruses are going to have similar symptoms. And so if you're vaccinated against flu or COVID, it's going to lessen the chance you're going to have to deal with these symptoms. It's going to lessen the chance that it's going to be flu or COVID. And it's going to decrease the hospital burden so that when folks do come in with RSV, they actually have a bed available to care for them.
We've been talking about infants. What about adults? Are they at risk, and can it be fatal?
Everyone is at risk. We know that RSV particularly hits children harder, but adults can transmit it. And so, again, the clean, cover, and contain, the 3 C's, are important for all of us. Make sure you're washing your hands. Make sure you're cleaning surfaces. Make sure you're staying home when you're sick. And make sure you're covering your mouth when you cough or you sneeze. So that way, even if you aren't sick, but you're carrying the virus, you're not transmitting it to someone who's around you.
Well, I want to go back to what you were talking about in terms of COVID and influenza. We talked about being separated for 2 years. Will this let these other viruses to run rampant again? And could this be a sign of a bad winter?
Well, there are a lot of signs that it potentially could be a very bad winter. We're seeing flu cases peak or start to rise earlier than usual. We're seeing RSV hit us hard. And when you look at the way COVID is starting to increase again, particularly with new variants, we could have a triple whammy that could really hurt our hospital capacity and our hospital system. So the question is, what can we do? We can take real and tangible measures by getting vaccinated against flu and against COVID. We particularly tell people to try to get vaccinated before the end of October for the flu, and talk to your doctor. If you have questions about the COVID vaccination, talk to your doctor. But those are steps that we can take right now, in addition to clean, cover, and contain. And also for those who are willing to do so, masking is not a bad idea. Masking protects you against COVID, but guess what? It also lessens your chance of getting flu and of getting RSV or spreading it to someone in your family. So if you're in an indoor environment, those are things that we can do to protect ourselves this cold and winter season.
Wish TV's medical expert and former U.S. Surgeon General, Dr. Jerome Adams. Always great to see you. Thank you.
Great to see you again, Dr. Gillis.